How much water should you drink per day? This is a very important question. It's something I get asked very often. How much water should a person normally drink? It's a highly relevant question, especially since people definitely ask me this in person. It's something that really concerns people, and it's very debatable, because the correct answer to this question isn't always pleasant for people to hear. But today we're going to talk about the amount of water you drink in a day. And I'll tell you everything about it. Let's start discussing this topic from the point that the water I drink goes into my stomach, then into my intestines, where there are special vascular plexuses, and all that water gets absorbed into the bloodstream. Of course, it goes through a sort of check, filtration, by the liver, but then it enters the bloodstream. And water, by providing for the bloodstream in my body, determines the volume of circulating blood. In fact, the water I drink ends up in my blood. If there is too much fluid in the blood, it immediately passes through the kidneys and is excreted in the urine. At the same time, a reverse osmosis system operates in the kidneys. And if some of the essential microelements from my blood end up in the urine and the kidneys, they are immediately reabsorbed from the primary urine during the formation of secondary urine. That's why you can't really drink too much water. But sometimes you don't drink enough water. So, the water you drink is necessary for metabolic waste products to be removed from the body during urine formation. In other words, the water I drink is needed so that I, get washed. My kidneys wash me with the water that I drink. So look, keep this in mind. So, let me put it this way. I'll give you a number that's important for our kidneys. For the kidneys to flush out the metabolic waste products from 30 kilograms of my body weight, they need me to drink 1 liter of water per 30 kilograms. Look, every cell in my body is like a living, self-contained organism. Every cell eats, and since it eats, there are byproducts from metabolism, basically waste. And the body needs to get rid of this waste. So, for my kidneys to flush out this waste, I need to drink 1 liter of water per 30 kilograms of body weight per day. For 60 kilograms, that's 2 liters. For 90 kilograms, that's already 3. So, it all depends on body weight. The amount of water you drink. It's a really silly belief to ask how much water a person should drink. I mean, how can we even calculate that? It's impossible. So, the amount of water you drink should match your body weight. Now, look, if someone tells me, here's a person who weighs 150 kilograms, does that mean they should drink 5 liters of water? Yes. You won't be able to drink that much, but that's not my problem. The heart can't handle it. It's actually easier for the heart to pump when the blood is more diluted. That's why the more water you drink, the easier it is on your heart and your cardiovascular system. Keep that in mind, too. But let's get back to the topic of water. So, I need to drink an amount of water that matches my weight, calculated by the formula 1 liter per 30 kilograms of body weight per day. But people ask me, could that be all liquids in general? Like, does soup count, or maybe compote, or coffee, or tea? No, we're talking only about water. All other products are considered food. It reacts with the enzymatic systems of our digestive system. And in that case, the water from them will only be used later on, and that's not the kind of water that will allow my kidneys to function properly. The water you drink is like the water you can use to wash your clothes. You won't have to rewash them. Take mineral water, you can wash your clothes in it. But if you take tea, you won't be able to wash your clothes in tea. And that's why water means just water. And specifically, we're talking about water itself. So, a person should drink water according to their body weight. Then their kidneys will start to function well. Yes, you might have to go to the bathroom more often, and the amount of urine will increase. But that's actually a good thing. In other words, Your kidneys will actively flush out your body, as long as you drink enough water. But sometimes people ask, can the amount of water you drink be harmful in any way? The amount of water can be harmful if you don't drink enough. If I drink too little water, then the urine produced by the kidneys becomes very concentrated. And the most interesting thing is that because the urine becomes concentrated, sediment starts to form in it. First, crystals appear, which leads to uric acid diathesis with the formation of these crystals. Later on, sand forms, which settles in the renal pelvis, and as the sand clumps together, it turns into stones. Did you know that kidney stones have only one cause, drinking too little water? Seriously, there's just one reason for kidney stones. You don't drink enough water. So what should you do? Just get yourself used to drinking water. Whether you want to or not, you have to keep track of it. You have to make yourself do it. People tell me, but I don't feel like it. Do I really have to force myself? Yes, you do. Yes, you have to force yourself. If you don't make yourself shower, you'll always be dirty. Your body doesn't demand it. But you have to make yourself drink water, make yourself do certain things. The scariest part is, it's not just about sand or stones in your kidneys. If a person drinks too little water, their blood thickens, or rather, the concentration of the blood increases. And this puts a strain on the cardiovascular system. It becomes hard for the heart to work. You see, if a person doesn't drink enough water, their subcutaneous tissue becomes less hydrated, and wrinkles start to appear. Yes, 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 wrinkles are a sign of people who don't drink enough water. Probably the scariest thing is this. People who don't drink enough water, yes, they often have hypertension. Hypertension is a disease of people who don't drink enough water. People with hypertension who drink 3 or 4 liters of water a day don't experience high blood pressure. Just imagine how simple that seems, right? But the scariest thing is something else. The scariest thing is that people who don't drink enough water, their brains dry out. Yes, exactly as I said. I'm a neurologist. I examine people with a reflex hammer. I check and test certain reflexes that appear in people as a result of, this is called cerebral cortex atrophy. And I check these reflexes. And so you see a person who is good-looking and smart. But then you check, these reflexes show up, and you realize that the person is only good-looking. Unfortunately, that already means the brain has dried out. And then I start talking to the person and realize that their level of communication, their level of awareness, is like that of a 3-year-old child, even though they're already 80. And the reason is, the brain dries out. And the deeper, secondary reason is that people don't drink enough water. You'd think, is it really that hard? Just drink water. But unfortunately, I have to point this out to everyone. I teach everyone about this. How many people actually drink water, try to drink water? I'll be honest, not many, very few. But everyone pays for it with their own health results. So, guys, today's information was specifically about the importance of drinking water. I want to remind you, if you found this information useful, please give this video a like at the end and share the link with others. By doing this, you could save someone's life and health, because this is vital information, and it doesn't cost nearly as much as expensive treatments.